Knee replacement surgery recovery, what to expect. Every patient who is going to undergo knee replacement asks one question for sure: what will be the recovery after knee replacement? The answer to this question is knee replacement is a surgery which is done through minimally invasive approach in today's world. In knee replacement, because patient is already not very mobile, the recovery is very fast as the pain goes down. The timeline of recovery from knee replacement surgery is: day 1, patient undergoes knee replacement. On the same day or the very next day, patient is made to stand. Patient undergoes first session of physiotherapy, and most of the patients start walking with the help of walker by the end of the day. From day 2 onwards, the physiotherapy continues. As the patient goes home from the hospital, his physiotherapy is continued and patient starts walking independently within 3 to 4 days. At around 15 days, the stitches are removed and patient is walking independently if it is single knee replacement, and with the help of walker if both knees have been replaced at one time. By 1 month, patient is completely independent, climbing staircase, even going out and having short walks. By the end of 3 months, patient is completely back to normal. So recovery from knee replacement is fast, and recovery for knee replacement is almost pain-free with medications and proper physiotherapy. Thank you, Dr. Ajay Randive from Dr. Randive's Super Speciality Knee Center.